thanks for coming, everyone. And as you know, tomorrow it's time for everybody to start having a conversation about mental health. So we thought it'd be good to get a few people together just to sort of see how we've managed to do these things before. And you know, certainly I think there's still that stigma because people are quite happy to openly talk to somebody about a broken arm or a broken leg. But if they know that somebody's suffering with their mental health, they don't like to talk about it. So, I mean, have any of you sort of come across that sort of scenario, or, you know, a time when it's been really difficult, when either you've been struggling yourself, or, you know, when...
You leave it off your CV.
Yeah.
To be perfectly honest, for 20 years I've been talking to once I did open up, once I did open up, I found there was so much help there, so many people willing to help, so many people empathetic towards me, and it was through that I managed to succeed in the things I've done over the past 10, 15 years. But the point I'm making is that, yeah, you know, there's been many times, and you can still, even now, I'm still careful who I speak to, because there is a stigma still attached to it. There is kind of, got kind of a bad name in a sense, if you understand me. But so I'm still careful who I speak to. But since I've opened up, then it's surprising just how much help is available.
Can you remember that time when you first did actually sort of open up to somebody then?
But it was but it was a mental health team at Seventh House. I can't actually remember when I have mentioned it in passing to people that have suffered from depression, because there's so many people suffer from depression. So I mean, it's not so stigmatised, I don't think, as it used to be. But I can't honestly remember, and I can't remember who I spoke. It's quite a long time ago. But what I'm saying is there was a big gap between having the symptoms of anxiety and depression and actually speak to somebody who wasn't in the medical profession. You know, there was a really big gap. But what I'm saying to you then is, when I did open up, I was absolutely astounded about the number of people who were willing to help you. And you know, but that's a message to anybody with mental health problems. Yeah, we're here today to find out how to get started to talk about it. But all I can say to you is, look, if you need help, ask for help. Make sure you go to the right places like Mind or a GP. But there is a lot of help there, so please, seek it out.
I don't know whether anybody's watching Coronation Street at the moment, but they're running a storyline with Steve MacDonald.
Oh, right.
Yeah, depression.
Yeah.
Of the Prod Rovers retained, and it's been running for a few weeks now.
Right.
And that's quite interesting. I mean, it's overplayed a bit.
Yeah.
But nevertheless, it could be quite useful as you know, something that people can talk about and relate to.
Yeah.
Because he's finally admitted to himself that he's got a problem, and he sought help, and he's going for counselling, something like that. But it is about, you know, very much about depression and his behaviour over the past few weeks.
Yeah.
And he lost his girlfriend, estranged from his girlfriend, and just about everybody around him. Erratic behaviour.
I think it's great when the soaps kind of get involved, because EastEnders do it, don't they, every now and again, and sort of have a storyline about mental health.
The funny thing is, usually at the end of the programme, they say, if you've been disturbed by this, I want further help or something, they'll give you a telephone number or something to arrange contact. And they haven't done that this time.
It is true. The first one. The first one, when you've been to the GP, at the bottom, you know, if you are suffering from this, if this has affected you in any way, contact somebody. So, but that was only the first. I mean, they should be doing every.
Yeah, they should do, really.
I think it's a start.
It is. It's a massive start. I think it's really good, because I think that's how you sort of reach the most people, isn't it? You know, through the popular soaps and things like that, and how they handle a storyline can be really, really important, because it does sort of, people do think, oh well, actually it's not just me, and I do need to do something about it. So
it wasn't until
really
I found an organisation like this, Mind, that restored my faith in myself. It's helped me in so many ways, you know, because I've had so much prejudice in the past. I've had knockbacks, I've been to job interviews, and I've just been, you know, I've really learned hearing but mine.
It's like everything.
I think you touched on you know, we've all got physical health, we can all have a physical health problem or break our leg or something like that. The same as we've all got mental health, and every single person has got mental health, and it's as much about that being collectively work towards maintaining a good sense of mental health as you know, as opposed to just thinking I must eat healthily, I must make sure I'm physically well, but I think it's as much a normal part of life to keep. You know, we've all got mental health, haven't we, essentially?
Of course, and it's surprising what pain you can suffer through depression. They call it imagined pain, which is the same as a real pain. But I mean, without going into a lot of detail, like Stuart, is it Hannah? Sorry. I've been on the floor that many times, you won't believe, but I've had to just drag myself up. And I don't know what point I'm trying to make at the moment, to be honest, but what I'm trying to say is that everybody, as Will said, everybody's got mental health. A lot of people have problems and they don't realise they have problems. And, you know, even a dodgy knee, the thing was arthritis, it could be to do with depression. But I mean, you know, there's so many symptoms. Endless.
The important thing to remember is it can destroy lives.
Absolutely.
It can destroy families.
Absolutely.
And lead to you know, awful happenings.
Can I just say that in my situation, I've been married 4 times. Mainly because my relationships I've been suffering from mental problems, and I've been looking for I don't know what I've been looking for, but I've been happily married now for 25 years, but I had a lot of relationships and they went haywire, mainly because, as Stuart says, it does interfere with your normal life. You know?
I mean, it definitely involves everybody, doesn't it? And you know, it just has such a knock-on effect. It's like that pebble in the pond, isn't it? And the ripple of everybody who gets dragged into that. I mean, I suppose really one of the things that certainly we see is that that's a really important part, is the support networks that are there for people, you know, so that when you do sort of feel yourself taking a dip, you've got somebody that you can talk to who's sort of there to support you and just encourage you to sort of access the right things, really, and to talk to the right people.
It took me an awful long time, you know, to find the right network of support. And now I accept that mental health problems is part of me. It's who I am, really, you know, and I've overcome a lot in my life, and I want to now, you know, help people reach out and just say it's okay to have mental health problems, you know, it's nothing to be ashamed of. It's part of you, you know, and you can get help. And there's organisations, there's a lot of support out there, and Mind is a really, really good network of support.
I think the secret of it all, in my case anyway, is to realise that you can't beat the system, you can't beat mental health problems, you can learn to live with them.
Because it's always going to be there, isn't it?
It's always going to be there.
You know. 1
step forward, 2 steps back. It's surprising, you hit the rocks and you think, oh, I'm not again, but then you think, well, I got through last time, so it's just a case of positive thinking and realising, as I said initially, that it's something you cannot beat, you cannot win. Just that you've got to learn to live with it, you've got to learn to cope with it, coping mechanisms, and you actually, and you may know this, you become the best actor in the world. You become the best actor because nobody has got a clue or don't know me that I've got mental problems, because I've covered it up that many times so well. And you'll find that. But as I say, if you can recognise that it's not a beatable type Campbell.
Intelligent, driven people, and those are often the people that are affected, you know, in work.
Do you think that's had a positive effect, all of these sort of famous people who have
so.
started talking about
I think
it?
so.
It has, but the thing is, they haven't actually, it's been on the news for about a day or so, and then it's just been, some of it, it's gone off the radar.
Yeah.
And I think all these politicians put around themselves around, as a person, I do. It was kind of one night on the news, it was showed everybody, all these politicians coming out and saying that. And then about 2 days later, of course, it was completely forgotten about and moved on. And it wasn't actually, they should have spent more time, I think. But then again, it's a news programme.
Yeah, they tend to sort of flip from one thing to another, don't they? You know, whatever they sort of feel is flavour of the moment, they'll capitalise on.
Yeah, absolutely. But
I think it has has helped, because again, it's about normalising.
It is, I think that's the key.
You know, it's about it's classless. It doesn't matter, does it? It doesn't matter where you're from. It doesn't matter what you do. It can affect people in all walks of life.
We can associate like bipolar disorder now. You know, you can associate that with people like.
Kerry
Yeah.
You know, her behaviour sometimes has been quite erratic, hasn't it? And then
Frank Bruno.
Yeah. So I mean,
but it's just getting it across, isn't it? That we all have mental health, and you know, it can affect every single one of us, and it does. So.
Do you think people do talk about it a little bit more then than maybe years ago? Are things improving slowly?
From the days when it was a taboo subject, and I, when I was a lad, they talked about mental hospitals, and if you had a mental illness,
you were locked away.
I was unfortunate enough to be admitted when I was about 18 to Delaporte, where Dr. Bickford was in charge, and he was an eccentric. I could go on and on about it. I'm not going to spend so much time, but I was actually, it was like being in a prison.
Yeah.
The phone was terrible. I was blackmailed into an ECG. I would not.
Families become quite involved in that sort of support network with the support they're getting from Mind or elsewhere as well. So I think that can only be a massive sort of step in the right direction.
We still get people jumping from on the bridge.
Yeah, we do, and
I know somebody who did it a year ago.
Yeah, it's been able to sort of access the services, isn't it? And I suppose if people feel they can't talk about it, then worst case scenario.
I've noticed that there's been almost a change in the sort of people who access Mind as a service now from we get a lot more people now that are in work and things like that, and and who sort of traditionally wouldn't sort of stereotypically suggest would be a mental health service user. It's people from all walks of life sort of access. Services.
And I think that's why we're having to sort of change our services more as well, so that those people who are in work and want to be able to access services can come to, for example, stress control on an evening, and sort of things outside of working hours, because they still want that support. So I think you're right. I think sort of people the demographic has changed.
Really.
There has been.
And that's possibly part of it becoming more of a normal thing, an everyday thing that people can accept as part of their.
And I think I've noticed as well that some people who've accessed services, they're actually doing that in conjunction with work. So work's allowing them to perhaps come for some counselling, or to come and access a service in particular that's going to help them. So I suppose that's really work kind of acknowledging it, and then feeling able to talk to people at work about it and what they need. And I know certainly there's a lot more training going on with like managers and people who need to sort of have a better awareness, don't they, of it's not just a matter of saying to somebody, pull yourself together, what's wrong with you, that it's something that people need some help with.
Well, there's a lot of organisations now actually are very empathetic towards it. I mean, my sister works for she's a works for Social Security. She was working for quite some time. She was getting counselling through her work.
Through
and I think some of these big companies like Asda and Tesco, I think they, but it's that ain't the problem. I think it's the smaller companies. And I'll go back to this. They want educating. They really need educating. And I think that's the key word, because it's just there's so much nonsense talked about mental health at times. It needs to be kind of I I can't think how to do it unless there was a particular television programme that might run for a series